man.
Hey, brother, how you doing?
I'm okay. How are you?
I'm doing well, thanks. Look at you. You look so professional.
I appreciate it, man. Thank you for taking the time. I started recording already, so it's been recording.
I
I'm gonna
saw,
start.
I saw that. I've been doing a lot of podcasts the past few
Cool.
months, part of our outreach and promotions. So that's why I've got the setup. I've got the light in front of me.
Amazing.
So I've been
Amazing.
on Riverside a bunch of times. This is like the industry standard, obviously.
I actually saw some of your podcasts, or some of the. There was one with a lady that you were doing a while ago. I see the little clips that you guys. I actually look at everything that you post on Instagram. I try to like everything, even though I don't have my own personal Instagram. I have the window company Instagram. So I'm just, if you ever see that liking your stuff, it's me.
Thanks,
It's
man.
not
I really
anybody
appreciate it.
else. Yeah, no, anytime, man. It's definitely the least I could do, man. If it's cool, I'm like, just generally, man. I have like a overview of some stuff, ideas, but by all means, feel free to chime in about anything you want to chat about. I don't want to take up too much of your time because I know it's precious and wonderful, and I thank you so much for doing this.
Well, you're very kind. Raj, I am excited for whatever it is we talk about, and we'll see where the conversation goes,
Cool,
and
man.
I'll put in my thoughts and any
Cool.
new ideas. So, yeah.
Amazing. I appreciate it. So, I'm going to do a little bit of an intro. So, Dr. Cory Goldberg, by the way, I totally took this from your website and condensed it down, but I just wanted to make it sound a little semi-formal. Um, so, Dr. Cory Goldberg, a dear friend of mine, former head of plastic surgery at Trillium Partners, certified plastic surgeon, Royal College and Physicians of Surgeons of Canada, a medical degree at Queen's University, advancing and specializing in craniofacial surgery. Active participant in Operation Smile, which I absolutely love, that helps perform cleft lip surgeries. Also, expert water skier and pilot, and somehow also a musician. Is there anything that you don't do, sir?
The I don't come late for dinner.
That's a good one.
Irrational life is about doing things and learning new things, and I try to learn something new every day and do something that scares me every day. And it's I don't know, it's about growth, right? And I know that
For
you're the
sure.
same. You are a man of many talents, and I know you have a similar philosophy.
Thank you, sir. I appreciate that. I always jokingly say to your lovely wife that if the world were to end and there was a capsule that we could put all the people into that ought to live, you'd be one of them. I would forcibly throw you in there, and I would just stand outside and wave at you through the window.
Stop. I'm honored to be included in that capsule, and I would make damn sure that you'd be in there. When there's that apocalypse, the people that you want
Right.
around you are those are the good people and the people who are capable, and you count as both of those.
Thank you kindly, sir. That means a lot. Maybe I'll come in now that you mention it. So one of the things that I actually talked to you last year about this a little bit with respects to the threading procedure specifically. And I was curious about that because I thought it's something that people that are coming into my age range, like I just turned 40, are things that they potentially would consider. And I was thinking, like, what would the regular person ask about? Because the threading is not a common terminology amongst everyone. Not everyone knows what that is specifically. But I guess I'll start off with, what's the difference between a facelift and the threading procedure?
Sure. So the threading procedure, a lot of people will refer to that as a thread lift. And just the name alone kind of gives you the idea of what it does. I mean, it's
Right.
lifting, it's pulling.
Hmm.
So, what makes a thread lift unique as far as a non-surgical aesthetic procedure is that it's actually able to pull and lift as
Hmm.
compared to the sort of standard non-surgical tools that we've had up until, the past few years, which were, filler or varieties of injectables that added volume, or neurotoxins like Botox and Dysport, which, paralyze muscles in a controlled way to soften expression lines and that kind of stuff. And for years and years, decades, we had just fillers and neurotoxin and some lasers and surface treatments. Thread lifts came along, and honestly, it took a long time to come to North America. It's been around for more than a decade in Asia, and it just took a really long time for Health Canada and the FDA to get around to approving that. but they pull, they lift, and that's what makes them unique, because in the non-surgical world, the other tools can't do that. And the way these threads work is they have barbs or cones. Some of them will have little cones along them, but the thread is put in with a needle, and the cones or the barbs on one half go in one direction, and in the other half of the thread they go in the other direction. So you can kind of feed them in, but then when you pull it back, it engages into the tissue. And similarly, the part of the thread's going back towards your ear or towards your temple, it goes in, but it can't be pulled downward. So because the skin around the lower portion of your face in the front is more mobile, and the tissue around your ear, behind your ears, your temple, it's kind of fixed. That bidirectionality of the thread allows you to tighten in the back and lift up in the front. So you put these threads in, and they sort of have the pull from the back, and they lift up the front, and they're dissolvable. That's a key component to this. So in the old days, if I could use that term, 10, 15 years ago, there were threads around in North America that were these barbed threads. They were permanent threads. They were made of plastics and other types of suture materials that did not dissolve. Those things are not safe. That is not a safe thing to do. I never got into that, and most people didn't, because it's like putting an implant into somebody, but it's one that can never be removed and has loads of complications. I managed lots of people who had complications from those permanent threads. That is not a safe thing to do. So what we're talking about now, these are dissolvable. They'll last about a year and a half roughly, and it does give you the ability to pull and lift, which if you put it into a bigger context of aging, pulling, lifting helps to get rid of the gravity effect of ptosis or sagging. Fillers can add volume in places that you've had volume loss, and neurotoxins can take care of muscle expression lines. So those three things together, combined with skin treatments like chemical peels and lasers, that's like a great non-surgical mix of how to manage someone in general. Now, how does a thread lift compare to a facelift? I mean, they're not really comparable, honestly. Besides the fact that both of them are lifting to some extent, facelifts, much more dramatic results. I mean, you get way more out of it. You are actually restructuring and removing tissue, removing skin. So the restructuring part internally of a facelift, the deep plane, the SMAS, the kind of internal, rather than just kind of tugging on it with a thread, you're actually going in there, manipulating it, lifting it, moving it. That's really the biggest effect of a facelift. And then you take out the extra skin that kind of comes from that restructuring, and that's the second part of a facelift. So the main difference then from the thread lift is the thread lift, you're kind of pulling, but you can't remove tissue. And even though you're pulling, you're not attaching things to new things. Like, you're not making a permanent change. This is sort of a suspension, and no matter what, the suspension is going to fail. I mean, it will pull through the soft tissue. The thread dissolves as it's supposed to, and it's good that it does, because if it didn't, it would leave you with lots of issues. So in the end, it's not really the same, it's not achieving the same end point. And a facelift, the benefits last forever. And what I mean by that is not that you'll look the same forever, it's that the benefit of having had that change is with you for a lifetime. I explain usually to patients, you're turning back the clock, but the clock continues to run. If we do a good facelift, we'll take off 10 good years. And, no matter what, 10, 20, 30 years from now, you are always going to look 10 years younger. You will always have the benefit of that surgery. So that's a long-standing benefit, where the thread lift is really a, year and a half you get, and then it's done. So, both have benefits, both have their place, and really, people got to make their decision of what they're looking for. But, I'm a surgeon. I favor surgical results, because I know that, I have more control. But there's people who, prefer a non-surgical approach. So, both have their place for the, the right patient.
That makes complete sense, which kind of segues into what I was going to ask next. You already alluded to some of that. Between the facelift and the threading, I guess the one that ensures more of a natural result would be the threading on the grand scheme, if you were to objectively compare the two, I would assume.
Yeah, honestly, Arash, I would say the facelift gives a more natural result. The thing about the thread lift that makes it natural is that the results are subtle. You would be hard pressed to pull hard enough on a thread lift to make someone look funny. And there could be little pulls here and there, but but at the same time, you don't have that much control. You can pull along the line of the thread, but that's it. So, a poorly done facelift, that, you can see that a mile away.
Yeah.
You can walk in the mall and point at that one and say, yeah, that's a crappy facelift. That's a crappy facelift.
Yeah,
right? We all know those people, but you don't know the people who have had the good facelift. So, honestly, I
indeed.
think both can be done very naturally. I think thread lifting is a little bit more subtle because it's achieving a more subtle result. But it really depends on the hands of the clinician, and most importantly, pick the right patient. If
Right.
the only tool you have is a hammer, everything is a nail, and you're going to hammer everything. But that's not how clinical practice works. You really got to assess the patient, see what's right for them on their preferences, their needs. So I think thread lifts and facelifts both can have very natural results, but obviously both have to be done well.
Understood. I guess I have two concerns personally with this, and I would imagine people have similar concerns. One is to, look like completely, diabolical in a sense, right? Don't want
Yeah.
don't want to do that, and which you addressed already. The second is my reluctance of going under local anesthetic
Mhm.
unless it's absolutely necessary. And I don't know too much about local anesthesia outside of, just what you've told me or what other surgeons may have told me, like when I wanted to go get my wisdom teeth removed, which I still haven't done and need to do. But local anesthesia for threading, like what is the duration that you're under for threading? And I guess how is it monitored? And how do you ensure that it's a safe environment with the anesthesia?
Yeah,
I
for
have
sure.
three-part question.
Yeah, well, I'll get to all the parts, but let's make sure that we're talking about the right thing because the
Right.
the difference between local anesthesia and general anesthesia is
Right.
is important, right? So local anesthesia means it's a local, one area that gets frozen. That's kind of like what the dentist might do with an injection of,
Got
of
it.
local anesthesia versus the general anesthetic or intravenous sedation in which patient has to be monitored. You're putting them to sleep. If it's a general anesthetic, they're fully asleep and you kind of take over their breathing and monitor their heart. So that's for bigger procedures. So when I do facelifts on patients, I will usually do that under general anesthesia. So I have patient fully asleep for that. Some people do that under intravenous sedation, and there's risks and benefits to doing it either way. Local anesthesia is where you do injections with something that freezes the area, makes it numb. When it comes to thread lifting, I actually do it with just topical anesthetic. And I used to do it with injection. So I would actually inject a little bit of local anesthesia at each spot that I would be putting the needle for the thread going into the skin. And I actually found the patients like that less. They found it uncomfortable getting the freezing. Whereas if I just put topical anesthetic on, it actually makes it not really that bad, and patients tolerate it really well, and they prefer it. So
Interesting.
yeah, so I mean, there's not really any need when you're doing a thread lift. It's an office procedure. It's an hour roughly for the whole thing, and it's just topical anesthetic. So put some ointment on the spots. I usually map out the places that I'm going to put the threads in. Put the topical on where I know the sort of needle is going to go in and where it's going to exit. Each thread, there's an entry point kind of in the middle of where it's going in, and then the thread has to go down in one direction and then back up in the other direction. So it kind of goes in one place and it comes out one place low and one place up high. So each thread has three spots. I put a little bit of topical on each of the three spots I'm expecting to come through. So if I put two threads on one side, that's six spots. Two sides, there's 12 spots. So 12 little pinches. Put some topical on. Patients tolerate it really well. So yeah, it's our topical anesthesia. Patient walks out and they see the difference immediately.
Thank you for the very thorough explanation. Sign me up. I'll take two. Um, no, no, seriously, that is very thorough, and probably when I asked you last time about it, I did not go this deep into it, so that gave me some more information to ponder. But I appreciate that. In your practice, you do a whole lot of other things, and one of which are hair transplants. And coming from two guys with a full set of hair, this might seem a little disingenuous, but nonetheless, I'm going to ask because I know it's a very commonly, I guess, searched but also pondered thing. People ask about it often. But I'll start off with saying, as you know, I used to frequent Turkey a lot because of my family, and the planes there were hilarious because you just saw people with bandages on the way back, rows on rows, and they have a whole industry there for that. And I would always wonder why so many people came. Naturally, the price is, a factor, but I would hear about these botched stories. I would hear about people getting their hairlines not put where they're supposed to be. There's actually a really funny example with an artist, Akon, where he went and did his. I think in some I think it was Turkey actually. I'm not sure, but it was in North America. And they brought his hairline completely up to here, and they just call him Acorn on the meme instead of Akon. So it's very apt, right? And someone you'd think with all that money would not necessarily cheap out and try to, save a couple of grand. But anyhow, I'm one to advocate for doing things in the West, particularly with its track record. But that's the most important. It's the track record because there's great doctors and surgeons all across the world. I guess that's what it really boils down to. But my question on that is, I guess before getting into surgery, is there anything that people can do preventative to, I guess, slow down baldness or pattern baldness?
Absolutely you can. So many things. Let's talk about lifestyle stuff first, and then we can talk about medical pharmaceutical stuff. So, just on a lifestyle part of things, people don't usually think about the way that their health and behavior impacts their hair. And it's interesting because even taking a step back, people generally don't really think about the way that their health and their lifestyle and behavior affects their skin. And of course, your hair is a part of your skin. But what you eat and your activity level and things you expose yourself to in your life, like smoking, alcohol, those kinds of things, that all plays a very significant role in the health of your skin and consequently the health of your hair. The very easy things that people can adopt in their life. First off, I advocate for a plant-based whole foods diet. Now, that doesn't necessarily mean being vegan. I personally aim for about 95% of my calories coming from the ground, but eating processed foods, eating sugars, eating animal proteins, those things are very harmful for you. They cause inflammation in your skin. There's oxidative stress, and that oxidative stress is inflammatory, and that's killing your hair cells. So your hair follicles suffer for the food that you eat. And the standard North American diet and the processed foods that most people are eating, I mean, it's atrocious, and it really causes hair loss. Absolutely. The inflammation, you can see it under a microscope, inflammation around the hair follicles. So that's one thing. Second thing is exercise. And again, you wouldn't necessarily think exercise, like what the heck does that have to do with my hair? But it comes back to that oxidative stress thing. So the oxidative stress in your body is kind of this constant battle of your body fighting against this chemical stressor that comes from just normal function of your cells. Exercise primes your body. It actually trains your body, and your cells start producing more of these mitochondria things, which is part of the energy production in our cells. It actually makes your cells better able to manage this oxidative stress. So exercise is like priming yourself to fight against the inflammation in your skin and in your hair. So diet, exercise, two key things people can do to improve skin health and hair health at the same time. So those are important things. I mentioned the smoking, drinking thing. Also, those things cause inflammation, oxidative stress. Definitely best to cut out the smoking for sure. Alcohol, personally, I'm 8 months not drinking. I made the decision to end that, and it's not hard at all. It's easy, and the reason that it's easy is because I now fully recognize the harm that it causes, and I want to keep this hair. I really like it, and it's mine. It's natural, and it's because I live healthy that I have this. So, and I'm grateful. I am very fortunate. I have decent genetics, but I can tell you my brother and my father don't have this, and I do, and it's because of the lifestyle that I lead that I've been able to do that. So. Lifestyle, number one, number two, number three, number four, going a little bit further down the list of things that people can do for hair. One really important one that I think gets left out a lot, especially for women, is tension. And so people will wear their hair in all kinds of tight hairdos, tight ponytails, high tight ponytails. They will put extensions in, hair extensions. Those things are pulling weaves, all of that stuff. The more traction, it's called traction alopecia. Alopecia is just the medical term for hair loss. Traction
Right.
alopecia is a real thing, and it is so common. And I see people in the practice regularly who have this that are losing their hair because of their hairstyle. It's a big thing in the military too, because they're expected to wear really tight hairstyles. So don't do that. So that's sort of another lifestyle thing. Uh, going on down the list. Let's get the pharmaceutical stuff. So
Mhm.
one natural sort of supplement that people can take that I'm a huge fan of that I've spoken to you about before, something called glycodin. Glycodin is Glisodin. Glycodin is a nutraceutical. It means it's a natural ingredients. There's no synthetics in it. This is actually an antioxidant. It increases your antioxidant defenses, and that's how it minimizes inflammation around your hair follicles. And it does it on the rest of your skin and your internal organs too, by the way. So it's actually really good for you in general, but it benefits hair growth because it reduces that oxidative stress and inflammation on hair follicles. So that's one thing I recommend for everybody. On the deep pharmaceutical side, there's something called finasteride, which is a brand name is Propecia, and that is a hormone receptor blocker. And that actually, for guys, is a huge cause of androgenetic or male pattern hair loss, and that blocks that sort of hormonal cause. So it's that Propecia finasteride. I recommend it for guys. Small risk of erectile dysfunction with that. I've never had a patient who's encountered that, and if you stop taking it, it reverses. So it's worth trying for anybody who is starting to see some hair loss. I would recommend going to your physician, talking to them about it, get a script for that, get on it. Even patients, when I do hair restoration on them, I get them on it beforehand, afterwards, as much as possible, because it really is a huge benefit. So that's another one. There's something called minoxidil. Minoxidil goes by the brand name Rogaine, and it's super cheap. You can get that at Costco. It's the most cost effective way of doing that. It's just a quick tip for anybody who's interested, and that's a topical. And it's a little irritating and it's a bit of a pain because you got to rub this stuff into your hair, but it's also very effective. And when it comes to hair loss, I generally recommend the kitchen sink. When it comes to managing it, everything. The more you do, the better. If you can do all these lifestyle things and you're taking that finasteride and you're applying minoxidil and you take some glycodin, all of that together is going to minimize the hair loss and maximize your hair growth. And that will hopefully stave off needing a restoration. You may never need that. And even if you end up having surgery at some point and doing hair transplant, this is going to set you up for success and it will give you the best possible outcome to continue these things afterwards. So those are all the things I recommend. In addition, there are treatments like red light or laser for hair. There are hats and other scalp treatments. It is effective. Be careful. There's a lot of devices on the market, and I can't say I support one or another. So look into the science. If you're buying a device,
Right.
just have a look and see what they've published. It needs to be legit. But that's it. That's kind of the summary of what's in place from the non-surgical side for hair.
Thank you for that. I appreciate that. Again, very thorough. You took some of the notes I had and just talked about them without me having asked you, which is fantastic. I love that. You touched on something. I'm going to segue just a little bit, if you don't mind, but I will come back to the matter because it's one of those things that you've mentioned many times, particularly as it pertains to the diet, and you yourself having a predominantly vegan diet, and how the red meat may potentially affect overall health. And there's something to be said about information across the spectrum when it comes to that specific component. For example, my family doctor quite literally verbatim asks me in my annual physical, biannual now, do you eat red meat? And when I say yes, he says good. And, that's always a point of curiosity for me, why there are divergent opinions. And I kind of want to, I'm not expecting you to clear the air or set it straight, but I am curious as to how you came to that opinion. I'm sure people want to know. And I want to know because particularly you saw me consume enough meat at a Korean barbecue once, enough for 5 people. And I saw the look of concern on your face when I was doing that. And I've toned it down. I do mix a lot of legumes and grains and rice. I'm even trying to eliminate a fair bit of bread right now for the most part, just to kind of get my athleticism back to where it used to be. But what is the discourse on that in terms of where is it basically leaning towards? Which one is, I guess, more correct than not?
Fair enough. So,
Yeah.
let's go through, sequence here. So first thing to state, there is no absolute right diet. There is some variation between people, and it's best to follow general principles and guides, and then make choices according to that and according to your own health metrics. So I can't say that there's one thing that's good for everybody, and I'll share why I do what I do, and I do think it's right for most people, but there's variation, and I'm prepared to accept that. So that's first thing to state. Second thing I got to point out, physicians, and I am one, I recognize fully, as a physician alone, my MD gave me pretty much zero knowledge on nutrition. We probably had one lecture about nutrition, and it was, the 4 basic food groups, and it didn't go much past that. And we studied physiology, very basic physiology. Physiology is the study of, how humans function. So the physiology of your gastrointestinal tract and how things get digested or absorbed, you'll learn a bit about that. But that's it. Telling someone how to eat or the ups and downs of different diets, that is not part of med school curriculum. So honestly, physicians, unless they've taken a special interest in this and learned about it on their own on top of med school, they don't know about diet. All they know is what they were taught or what their colleagues said to them, and it's more of their personal preferences or biases. So those 2 things having been stated, next thing to say, why would people say that you should eat meat? There's got to be a reason, because some people are saying it. Right. So let's look at the reasons. So reason number 1, which I think is the most wrong reason, cavemen, the caveman diet, right? We evolved this way, right? Our cavemen, look at the pictures you see, the caveman with a big, thing, and they're, eating, and they're ripping, they're, taking down the mammoth, and they're eating all the meat, and that's how we evolved. So of course we need meat, right? And that is complete, I don't want to swear, this is a complete bull tonky, right? And the reason that that's complete bull is because our evolution, hominids have only existed on the planet for a couple 100,000 years. Primates have only been around for a few million years. Our evolutionary chain started 3.5 billion years ago. Billion, right? I mean, the biochemistry in our cells is not very much different from a tomato. We still have the same mechanisms, our antioxidant mechanisms, most of our biochemistry, our energy production. We have mushrooms have the same mitochondria to produce energy in their cells the way we have it in our cells. There is fundamentally almost no difference between us and those organisms. And so to say in the past couple 100,000 years, for however many thousands of years where there was not a lot of plants around, and people only had access to meat, and they ate predominantly that kind of diet, that's how we evolved, so that's what we should eat now, that's dumb. I mean, it's just flat out dumb, right? We have 3.5 billion years of amazing mechanisms that have been built up, and you can't ignore those and just favor the one just because you like to eat meat, and that's what you're going to point at those cavemen. So that's a biased and foolish decision to make. The last thing to say about that is also, our ancestors at every stage of evolution, both as primates and hominids, and prior to that, you ate what was available. And that changed,
Exactly.
right?
Yep.
I mean, there were times of great drought or solar flares, and there was nothing available to eat. And so, you eat what's available. We're past that, right?
Yeah.
We have an organized society. We can eat what we want to. So it's a question of deciding what is the best for us, what's healthy, not just what's available. So the whole meat thing, because that's what was available at the time, and so therefore we should eat it now, that's foolhardy. The next thing, why people would tell you to eat meat, it's protein. And definitely the best part of meat, the thing you're going to get out of it, is protein. And it's really, really important to have enough protein in your diet. So important, especially if you're building muscle, which we should all be doing, because that's, you got to keep that going for a lifetime. But just for normal function, you need protein, and a lot of people don't get enough. So eat meat. It's a very easy way to get protein. My argument against that: there's protein in plants. You just got to choose the right ones. And you got to make sure that you're eating enough of it. If you need, roughly speaking, you should get about a gram per day per kilogram of your body weight. So, if you're a 70, 80 kilogram male, you should get about 80 grams of protein in a day. So, even round that up, call it 100 grams. So, you could eat a steak and get all that in one go. But you're going to get a lot of bad stuff that comes along with that. So, my opinion, best to get your protein from plants. So, let's flip to the other side of that discussion. Why the plant thing? First off, there's lots of protein in plants. You just got to know which ones to eat. Plants also bring a bunch of other things that you need too. Nutrients that you can't get from meat, and fiber, which you definitely don't get from meat. One of my biggest concerns about the North American diet is the fact that there is not enough fiber. We do not eat enough fiber, and it is the reason that we get colon cancer and diverticulitis and gout. Is because we are so focused on animal proteins and we don't eat enough fiber. If you go to Africa, colon cancer is almost unheard of there, and it's because they're too poor to buy all the fancy meat that we think we should be eating, and they're eating fiber, and so their diet is actually better than ours, and they have less health issues as a result of that. So keep your fiber intake up. You need plants for that. Also, there's a bunch of really good substances that come with plants and with mushrooms. These are phytochemicals. Phytochemicals are chemicals that come from plants or mushrooms, and they are good for you. They activate mechanisms in your cells. They fight cancer. They reduce oxidative stress. They help repair things. These are super important. Your diet is almost like a communication with the earth. When you eat, it actually signals your brain, your neural network rewires based on the food that you're eating. Based on the local, it actually knows where you are. It's really, really remarkable. And so if you skip that and you're just eating animal proteins, you're totally missing out on all the benefits of those things. That's in a nutshell why you need plants and mushrooms in your diet. There are actually certain substances that are almost only found in mushrooms that are hugely important for your brain function long term. There's this thing called ergothioneine. Ergothioneine, you get a little bit from vegetables, but the best way to get it is from mushrooms. So, put that, and mushrooms are a great source of protein, by the way. So putting all that together to get your phytochemicals that you need, to get the fiber that you need, and to get all the other nutrients that you need, plants have it. And the only thing you can't get from plants is B12. So, if you're going to follow a true vegan diet, you got to supplement B12. I do that. I take B12 and make sure I measure my B12 levels. That is important. So, that's my thought. My aim is not to be vegan. Vegan is a very militant approach. It is more of an ethics. The decision is made based usually around either the environment or animal safety or cruelty. And I fully believe, I don't like animal husbandry. I think it is cruel. I don't like the impact it has on the environment. I think it's terrible and it needs to change. But those are not my motivating factors in my diet. My motivating factor, number one, is my health. And I know very well that if I follow a diet that's 95% or more whole foods, plants, and mushrooms, I'm going to be the healthiest I can be. And there's a ton of evidence to back that up. And I'm here and I still have a full head of hair. So I'm doing something right. And I've only been doing the plant-based thing for 7 years. So one last factoid, if I may, interestingly. So
yes, please.
Every molecule in your body gets replaced every 7 years. So Arash, the person I'm talking to today, 7 years from now, cognitively, you may be the exact same person, 7 years more matured perhaps, but your body physically, every cell in your body will be totally 100% replaced in 7 years. So just think about the fact that you got to bring the right molecules in your body, the building blocks that are going to make up a new you in 7 years. So I've been plant-based for 7 years, so I figure my cells are now healthy plant ones.
They most certainly are. That's all very fascinating. Next time my meat-eating friends try to persuade me to gorge, I'll call them a tomato, and they won't know why. But then I'll give them an explanation that you're genetically more alike to a tomato than you probably realize. Yeah, I know. So a lot of what you said are things that I consider and have considered. Some of them, I'll be frank, I was certainly not aware of, and again, I appreciate the thorough explanation. Particularly the concept of availability of foods in your geographical domain. Even from a hunter-gatherer perspective, which is a dominant argument, even them, they would have a kill once a month, and they would gorge on the meat for a few days, and they wouldn't eat meat for a whole month. And when berries were in season, they would only eat berries and subsequent fruits and vegetables that were quite literally in season. But now we are quite literally just so fortunate, that's one way to put it, but just inundated with selection. And, you walk into these supermarkets, and I mean, by golly, you could buy elk meat, you know what I mean? You could buy camel meat. I've seen in St. Lawrence Market crocodile, turtle, and these are all the exotic meats, but let alone just having the availability of every type of poultry, various different types of red meat, always available to you. It's certainly tempting, right? And I think that control aspect of it is something that people don't really have, and even if they want to, it's hard to have it, but also that knowledge of knowing kind of what we ought to be consuming, not based on hearsay or some invalid argument, but scientific fact more than anything else. So I appreciate that insight. That's actually wonderful. It's certainly giving me more to think about in that regards.
It's my pleasure, man. When it comes to diet, and especially related to meat, it's such a personal thing. And honestly, when you eat meat, and look, I love meat. It's delicious, right? I haven't eaten it in 7 years, but it tastes good. and honestly, that's the hard thing. It's like this thing that tastes good. It actually releases endorphins. It gives you this full satiated feeling. It's addictive, right?
Yes.
It is addictive to eat sugars. It is addictive to eat these animal proteins. And also, especially in North American society, there is this attachment to meat and masculinity, right? There's this, I eat meat like a caveman, I'm tough. There's this barbecue culture, I'm burning, I'm cooking with fire. And it's such a personal thing. When it gets to that point, people will look for arguments to support what they already want.
Absolutely.
And so, to me, masculinity is not about burning a piece of meat on your barbecue and eating a big steak or whatever. To me, masculinity is being healthy. It's having a full head of hair. It's not having vascular disease and dropping dead of a heart attack when leaving a wife and young kids behind. How many times I've heard this story? I'm sure you have. I had a friend. He was an orthopedic surgeon, fit guy. Tennis player. He played like 4 or 5 games of tennis a week. He worked out like a fiend. He ran. Mid-40s, dropped dead of a heart attack, and it absolutely could have been prevented. I know that now. It was not being tracked. He had no idea he had these risk factors, and that happens. So I'll tell you what's masculine. What's masculine is being healthy. What's masculine is having a full head of hair. What's masculine is being able to get an erection and not having vascular disease that causes erectile dysfunction. Right? How many guys in North America suffer from that? It is such a common thing, and no one talks about it. Diet, lifestyle is the biggest contributing factor, and it's the vascular disease that it's being caused. And eating animal protein is a principal cause that trickles down, that results in that erectile dysfunction. So that guy who feels so masculine because he's got the steak in one hand, he doesn't have his other piece of meat in the other hand because it's not ready to work for him. So, right, this is it. This is about being healthy and being at your peak performance.
No, amen to that, first and foremost. Which what you were talking about right now completely has to do with what I was going to bring up next, which part of the masculine concept, aside from gorging meat and working out, is testosterone and testosterone levels. And this is something that has become a lot more prevalent in the limelight in overall discourse, particularly among social media. particularly amongst the youth, which are experimenting with things like testosterone therapy. And I guess before I even get into that, should men in their 20s, do you think they should test for a baseline? Is that something that we're not doing currently? And should it be done based on all these nutritional factors that you're talking about that could potentially affect, the testosterone and hormonal levels perhaps at a young age?
So, I think the answer to that is yes. Um, and I don't think that's just true of hormones. I think that's true of a lot of things. I
Mm-hmm.
think that our general approach to healthcare, our system of health, and I don't mean the funding, I don't mean government or private or public.
Right.
I mean the way we monitor health and provide health as a system is deeply flawed. And the flaw is we don't start early enough, and we do almost nothing in terms of prevention. By the time we pick up diseases and find stuff, it's too late. You missed the boat. Cancer is already there. Cancer's got to be prevented 20 years before you have a tumor. And so your question, measuring testosterone and hormone levels in 20s and teens, I think absolutely. And not just your hormone levels. You should be testing your electrolyte levels, and you should be testing your vitamin D and your B12 and a whole bunch of other metrics. You should get your genetics tested. All of that should be tracked regularly, because there is systems available that can look at that and even integrate your wearable data and put all of it into a health picture that allows you to monitor and predict health issues
All right.
decades
Right.
before it happens.
Right.
So absolutely, I think that young people should be tested. It's a part of having a dashboard and knowing what your health is and managing it in a proactive fashion.
I wholeheartely agree. To that end, you're working on something with Mr. Shmooney, if I'm saying his last name correctly.
Yeah.
God bless his soul, wonderful human being, which essentially takes that genealogical and predisposition aspects and tailors a health regimen specifically to, favor positive outcomes for that individual. And that's the gist of it. I believe that's what I understood from it. But I was hoping maybe you could tell us a little bit more about that endeavor and how it actually works in terms of practical approch.
Sure. So my partner in this endeavor, Dr. Fadi Shmouni. Fadi is a remarkable guy, and he is an endocrinologist and a geneticist. Endocrinologists are physicians of hormones, and a
Right.
geneticist is what it sounds like. I mean, they're physicians that understand genetics and how it impacts diseases. And both of those are really powerful tools. So he and I and a couple of others have co-founded a company called HealthSpan Digital. And HealthSpan Digital, it's not B2C, so we don't have clients directly. Our clients are businesses. We're B2B, and this B2B business is about providing these tools of longevity to other businesses. And tools of longevity, there are a lot of different examples. I mean, these are lab tools, like things that can measure basal metabolic rate or VO2 max. We can assemble these tools. We have a full kit of supplements, IV therapies, testing kits for hormone testing, and basically the ability to kind of put together the tools necessary to create longevity programs. And part of that is a software house. We have several software packages that are licensed, and we have our own software house working to integrate and add more. And so these tools all together mean that businesses can provide their patients, customers, or employees, or insurance companies can offer these benefits to their members. These are ways that people can monitor their own health, and enhance it with a variety of different tools. So really, it comes down to putting the tools to allow that monitoring and implementation around healthy longevity into the hands of anybody, any business that wants
Got it.
to offer that to
Got it.
somebody.
Got it. I appreciate that. So it's a business to business sort of venture. I assume it's proprietary software and practices and kind of like an operational workflow for these I guess offices that want to endeavor to, integrate these sort of things. And I guess it's like a license basis. Is that how it works? They come to you guys and you give them what they need to operate and they take it from there.
You got it, exactly. So,
Yeah.
the
Yeah.
business would come to us and say, we want a longevity program. This is the
Yeah.
space we have. This is what we want to offer. And we tailor the solution to them and figure out what they want as far as those assessment tools, setting up the physiology lab to do the baseline testing, the various kits and things for genetic and epigenetic testing. So we customize that for each business and what they want. One of the software pieces we have is this thing called Longevity AI, which is a really cool software piece, and it was developed in Tel Aviv, Israel. And the guy who created it is just like he's like a data monster. He's unbelievable. And so this thing actually has leveraged over 1,600 published papers, all of which have been vetted and entered into this network, that allows decision making based on actual scientific data. And it can integrate information on a patient from any source, blood work in a PDF document, genetic testing, wearable. All of that gets put in, and the person then in real time, adding in additional data, will get advice on things that they can do to modify their lifestyle to enhance their cardiac health or their intestinal health. So it actually gives real world recommendations, like the weather outside is good and you like running, so you could go for a run, or swimming, or it actually advises based on local environment activities and things that you could do in your lifestyle. So that's
Cool.
very cool, very personal software,
Yeah.
and so I mean that's one of the tools that we have to offer.
Very cool. Anyone in North America or around the world, is that available? I know it's a relatively new-ish endeavor. Is it available for people right now, these longevity clinics in Toronto? Maybe not necessarily your program, but is this something that people have access to in North America? Can they do it?
Yeah, so
Yeah.
I don't know that, I mean, this specific software piece, there's a few clinics that we have
Sure.
provided that to, but in general, the concept of healthy longevity, it is growing rapidly. And in North America, there are a lot of clinics that are opening that offer this service. There's going to be some shift in that market. Um, a lot of these clinics have launched on the premise that they offer a very VIP premium executive service with an expectation of a very high value membership that they provide, and there are only so many people who can afford those levels, and so there has been a bit of a right sizing in the market already. There's been a few clinics that have had to shut down across North America that just weren't able to be profitable. So I think the right model on how longevity will be provided is still being developed, but I really do think that the goal of the industry is democratization. It is to spread these tools and change public health. And so I think the right approach to this is to give these tools to clinicians and practitioners of all varieties, primary care physicians, medical clinics, medical spas, aesthetic centers, anybody who wants to offer health to their clients or patients. These tools will let them do it, and it can be
Mhm.
done in a very cost-effective fashion. And there are various levels that people can get involved, but once you start down that path of almost gamifying your own health, when you actually see that you can impact your heart health, and you're exercising for a month, and at the end of that you recognize that your cardiac health has dropped by a few years, you're younger, your
Right.
heart appears younger. That's very motivating. To
Very much
me,
so.
those metrics, once people have that, they're going to want more. They're going to look to do more
Right.
things to keep themselves
Right.
healthy.
Right.
So to me, this is about getting this out to the masses in a
Right.
cost-effective fashion.
Right.
That's still developing. Right now, the
Yes, it
clinics that
is.
are opening are not quite there. They're still pretty high end, but they are available, and there's lots around. We will have some coming to Toronto in the next year. We have a place opening up in Yorkville, called Supernatural, which is opening, pop up, should be open within the next few weeks. We have a soft launch coming.
Amazing. Amazing. I was going to say, please plug whatever it is you're working on right now. And you already did, which is fantastic. And I'll be there, but possibly with my dog, at least to say hello. She's passed out on the ground right now. She just got tired from nagging too much. I'm like, I had it on mute for a little bit. I was like, you know what, Marley, just here's some treats, please. But no, that's Cory. That's all very fascinating. It's one of those things where that gamification, democratization aspect that you're talking about, it's already starting to be very prevalent in our devices. You know, with the Apple Watches and even just your phone with the step counter, and it enticing you to, take further steps. It literally bugs you, and it works. It actually works. And if that concept could be, put into something a little bit more nitty gritty, a little bit more versed with specifics rather than just, your counts, your step count, I think there would be the potential for engagement. That being said, I'm one of those people that also, too much technology is also not the best thing in the world either. I'm a proponent of doing things with your own will, but some people need that push. And I guess once you get those habits going, you'll start doing it yourself, in essence. Hopefully it becomes habitual after a while, and the software will enable you to get those habits in line. And that's hopefully the general idea for all of this.
Yeah, absolutely. I think you're absolutely right. And there's a limit to sort of how much tech to have in your life. The
Right.
good news about this is this technology will help you develop the right lifestyle for today. And
Exactly.
then, a month from now, 6 months from now, a year from now, maybe you don't need it quite as much because you already have those habits in place. However, life is long, right? What you need in your 40s versus what you need in your 50s and 60s is going to change.
Right.
And the goals that you need each decade are going to change too. Certain decades of your life are going to be about building up so that you have a bigger reserve for later decades in your life. So, with that change in metrics, and they'll be changing your environment, you can be sure your diet is going to change over time just based on where you're living or who you're married to. All of these are going to be things that change your dashboard. And so that's one of the reasons that I personally I wear, my Aura ring is on. That's my wedding ring as well because I want to live a long and healthy life because I'm married to an amazing
Beautiful.
person. And this is one of the things I do to keep myself healthy. But that data, that information that you track about yourself, long term, that the trends and how that shifts, that's so valuable. And so, if you think about your body as being like a car, you're driving down the highway, you always want your dashboard on. Let's say you're driving on
Right.
the 401 on a long trip, and you're like, oh well, you know what? I don't really need to know how fast I'm going right now because I've been driving at 100 the whole time. I'm good. Well, I don't know. Are you sure you're driving 100 if you turn off your speedometer? You know, there's important, checkpoints. So I agree that there's a limit to how much tech you should have in your life. And once you settle into a regular, pattern, maybe not quite as much as necessary, but collecting that data and tracking it and also being aware of that as a dashboard of life as you're kind of driving down the highway of life, that's super important. And I think that people really underestimate keeping that information about themselves.
Very insightful. I appreciate that. I could talk to you about this for hours on hours, but I'm not going to do that at this moment. We could possibly do another session another time. I would sincerely appreciate that. But wow, that was super insightful. God bless you, sir. Every time I talk to you, whether it's in a setting like this or, Christmas dinner or Christmas Eve, that was lovely, by the way. I learned something new, and I'm very fortunate to have someone such as yourself in my life, and I appreciate you taking the time. Is there anything that you wish to say before we conclude this, or should we wrap it up?
Well, you
Or
know
are
what?
you good?
I'll share one thing. The
Sure.
the most important thing when it comes to healthy longevity is love. It is connection to other people and just sharing. So yeah, I love you, man. You're an awesome guy, and
Love you too,
and I
bro.
encourage everyone listening. love more, connect with people around you. It means everything. It is your health, it is your longevity, and it will make the world a better place. So that's my advice to the young people. Love more. And it was a pleasure having you over for Christmas Eve. You're a solid guy. You're a part of the family, and absolutely, I'd be thrilled to have another session whenever it suits you. And likewise, I always learn something new when we chat. You're a wealth of interesting information, and
Thank you, sir.
and I am always impressed by your breadth of knowledge. So thanks so much for the conversation. I had a great time, and looking forward to our next session.
Much appreciated, sir. You have yourself a wonderful evening. Take care. Thank you.
Thank you. Take care.
Bye.